Welcome to Explain, a series of health education programs published by the Patient Education Institute, the leading provider of interactive health education. This video includes general medical information and does not replace the medical advice of your doctor or healthcare provider. If you have questions pertaining to your medical condition, ask your doctor or healthcare provider. Impetigo. Introduction. Impetigo is a skin infection that is caused by bacteria. It happens most often in children between the ages of 2 and 6. Impetigo starts when bacteria enter the body through a break in the skin, such as a cut, scratch, or insect bite. Impetigo is very contagious. It usually clears and goes away on its own in 2 to 3 weeks. Rarely it may lead to serious complications if untreated. This program explains impetigo. It discusses the symptoms, causes, and treatment of the infection. The skin. The skin is the body's outer covering. It protects us against heat, light, injury, and infection. It also regulates the temperature of the body. The skin is the body's largest organ. It has 2 main layers, the outer epidermis and the inner dermis. The epidermis, or outer layer of the skin, is mostly made of flat, scale-like cells. They are called squamous cells. Round cells called basal cells are below the squamous cells. The deepest part of the epidermis is made of cells called melanocytes. Melanocytes make melanin, which gives the skin its color. The dermis, the inner layer of the skin, contains blood vessels, nerves, lymph vessels, hair follicles, glands. The skin contains a fine network of nerves. This network gives us the ability to feel sensations and pain. A rash is an area of irritated or swollen skin. It might be red and itchy, bumpy, scaly, crusty, or blistered. Some rashes develop quickly and others take several days. If you scratch a rash, it may take longer to heal. Symptoms. There are several different types of impetigo. They include impetigo contagiosa, bullous impetigo, eczema. Impetigo contagiosa is the most common form of impetigo. It usually starts as a red sore on your face, often near your nose and mouth. The sore soon ruptures. It oozes a fluid or pus that forms a gold-colored crust. Eventually, the crust will go away. It leaves a red mark that usually heals without scarring. Impetigo sores may be itchy, but typically they aren't painful. Impetigo contagiosa usually does not cause a fever, but it may cause swollen lymph nodes in the affected area. Because it is very contagious, touching or scratching the sores can spread the infection to other parts of the body. Bullous impetigo often affects babies and children younger than 2 years. It causes painless blisters that are filled with fluid. The blisters usually happen on the arms and legs. The skin around the blister is usually red and itchy but not sore. The blisters break and scab over with a yellow-colored crust. They may be large or small. They may last longer than sores from other types of impetigo. Eczema is the most serious type of impetigo. It affects the dermis on a deeper level than the other forms of the infection. Symptoms of eczema include painful sores filled with fluid or pus that turn into deep ulcers, usually on the legs and feet. Sores that break open and scab over with a hard, thick, gray and yellow crust. Scarring after the sores heal. Swollen lymph nodes in the affected area. Sponsored by the Patient Education Institute. www.patient-education.com. Over 5,000 videos and interactive tutorials. Causes and risk factors. Impetigo is a common type of skin infection. The bacteria that cause impetigo enter through some sort of break in the skin, such as a skinned knee, cut, or insect bite. Even very small microscopic breaks in the skin may allow bacteria to enter. Once the bacteria get into the inner layers of the skin, they grow and multiply, creating a blister. Usually, this blister becomes filled with pus and bursts, leaving a crust. Two types of bacteria cause impetigo. The most common type is staphylococcal or staph bacteria. Sometimes streptococcus or strep can cause it. Both types of bacteria can live harmlessly on your skin until they enter through a cut or other wound and cause an infection. Staph bacteria produce a toxin that causes impetigo to spread to nearby skin. The toxin attacks a protein that helps bind skin cells together. Once this protein is harmed, bacteria can spread quickly on the skin. Impetigo can spread from person to person. You can be exposed to the bacteria that cause impetigo when you come into contact with the sores of someone who's infected, items an infected person has touched, such as clothing, bed linen, towels, and toys. Once you're infected, you can easily spread the infection to others. Although anyone can develop impetigo, children ages 2 to 6 years and infants are most often infected. Children have a high risk of infection because their immune systems are still developing. Impetigo spreads easily in school and childcare settings. Other factors that increase the risk of impetigo include warm, humid weather. Impetigo infections are more common during summer months. Participation in sports that involve skin-to-skin contact, such as football or wrestling. Diagnosis. Your healthcare provider will perform a physical exam. He or she will ask you questions about your symptoms and medical history. Usually, healthcare providers can diagnose impetigo based on the sores it causes. A test known as a culture may be needed to confirm the diagnosis or to rule out other causes. During this test, your healthcare provider uses a sterile swab to gently remove a small bit of fluid from one of the sores. The sample is then examined in a laboratory. If it contains the bacteria that cause impetigo, your healthcare provider will diagnose you with the condition. Treatment. Impetigo treatment can speed the healing of the sores. It can also improve the skin's appearance and limit the spread of the infection. How impetigo is treated depends on several factors, including the type of impetigo and the severity of the infection. Treatments for impetigo include hygienic measures. Keeping the skin clean can help mild infections heal on their own. Topical or oral antibiotics. Avoid scratching or touching the sores as much as possible until they heal. Applying a non-stick dressing to the infected area can help to keep impetigo from spreading. Other people may become infected through close contact. Use separate washcloths and hand towels. Often the rash will go away on its own, but antibiotics are sometimes needed to get rid of the infection. A topical antibiotic can be applied to the affected area. Before applying the antibiotic, you need to gently remove any scabs. This is so that the antibiotic can enter the sore. Soak the affected skin with a mixture of vinegar and water. This makes it easier to gently remove the scabs. After washing the area, apply the antibiotic ointment. You can do this 3 times every day. Oral antibiotics are pills taken by mouth. They may be prescribed for widespread impetigo, eczema, and severe cases of impetigo contagiosa. Take all of your prescribed medicine and antibiotics. Do not stop taking them just because you feel better. If you stop them too soon, it could cause the infection to come back. This can make it much harder to treat. If the rash grows, becomes more painful, or worsens in any other way, contact your healthcare provider. If someone in your family already has impetigo, you can help to prevent the infection from spreading to others. Wear gloves when applying any antibiotic ointment and wash your hands thoroughly afterward. Make sure the sores are covered with gauze or dressings. If your child is infected, cut his or her nails short to prevent damage from scratching. Keep your child home until your healthcare provider says he or she isn't contagious. Wash an infected person's clothes, linens, and towels every day and don't share them with anyone else in your family. Complications. Impetigo typically isn't dangerous, but sometimes it can cause rare but serious complications. Complications include post-streptococcal glomerulonephritis, or PSGN, cellulitis, methicillin-resistant Staphylococcus aureus, or MRSA. PSGN is kidney inflammation. It happens when antibodies formed as a result of a strep infection damage your kidneys. They harm the part of your kidneys that filter waste. Although most people recover without any lasting damage, PSGN may lead to chronic kidney failure. Signs and symptoms of PSGN commonly appear about 2 weeks after an infection. They include facial swelling, especially around the eyes, decreased urination, blood in the urine, high blood pressure, stiff or painful joints. Most often, PSGN affects children between the ages of 6 and 10 years. Adults who develop PSGN usually have more serious symptoms than children do. Adults are less likely to make a full recovery. Although antibiotics can cure strep infections, they don't prevent PSGN. Cellulitis is a serious infection. It affects the deepest tissues of your skin. The skin becomes red, hot, irritated, and painful. Eventually, cellulitis may spread to your lymph nodes and into the bloodstream. Left untreated, cellulitis can cause death. MRSA is a strain of staph bacteria that resists most antibiotics. It can cause serious skin infections that rapidly get worse. They are very difficult to treat. The skin infection may start as a red, swollen pimple or boil that drains pus. MRSA may also cause pneumonia and blood infections. Other complications of impetigo include scarring, lightening of the skin, darkening of the skin.
If you like this video, please like and share. For similar videos, subscribe to our channel.
Summary. Impetigo is a skin infection that is caused by bacteria. It happens most often in children between the ages of 2 and 6. Impetigo starts when bacteria enter the body through a break in the skin, such as a cut, scratch, or insect bite. Impetigo treatment can speed the healing of sores. It can also improve the skin's appearance and limit the spread of the infection. How impetigo is treated depends on several factors, including the type of impetigo and the severity of the infection. Impetigo typically isn't dangerous, but sometimes it can cause rare but serious complications. Thank you for using Explain.